Hello, Brazil. My name is Mark Gilger. I'm a professor of pediatrics and pediatrician in chief at the Children's Hospital of San Antonio. Today's session was on critical foreign bodies in children. And one of the things I would like to mention is two issues we've come up with of great significance. The first is the small round magnets, so-called neodymium or rare earth magnets. And these magnets look like candy. They're small, they're tiny, they're attractive. It's what we call innocuous. But young children, little ones, age 1, 2, 3, think they look like candy and they eat them. And older children, 7, 8, 9, 10, teenagers, try to mimic piercings. And we could take a magnet and put it on one side of my finger and one on the other, and it will hold together. And so they can mimic piercings of the nose, of the tongue, and of the lip. And as you might guess, they can be inadvertently swallowed. Problem is, when these things get into the GI tract, the swallowing tube, the stomach, they attract again. And they'll attract each other between loops of bowel. So for example, between the esophagus and the stomach, or between the stomach and the small bowel. And that's a problem, because within about 12 hours of these magnets being close together, they'll perforate through the bowel wall. So very, very important to understand that these small little toys can be very, very dangerous in young children and even in teenagers trying to mimic body piercings. The other big topic we talked about this morning was the lithium batteries, or the batteries we find in our watches and in our cameras and so on and so forth. About 15 millimeter size, and they have a positive and a negative pole on them, and the kids swallow them. And if these things get stuck in the swallowing tube, the esophagus, they can perforate, because once inside, the esophagus is flat. And if we put a battery between two flat pieces of tissue, it'll burn. And so we have had many cases now of children swallowing these batteries, having them get stuck in the esophagus, and then perforate through the bowel wall, even into adjacent blood vessels, such as the aorta, and causing serious, serious problems. So our major take-home for today, for the whole issue on critical foreign bodies in children, are number one, the dangers of these small, round neodymium magnets, and number two, when you have a lithium battery, a watch battery stuck in the swallowing tube, take it out as soon as you possibly can.